Hi there. What can I do for you today? You want to get a flu shot? Oh, that's great. Yeah, as you know, it is really important not only for yourself, but for the community as a whole to, make sure you're immunized against the flu. Well, yeah, it is very important because children and elderly people and, people that have immunocompromising diseases, they can't always get immunized against the flu. And so it's very important that the rest of us make sure we're doing everything we possibly can to, keep them from catching it. Yeah, it can have catastrophic consequences on them that, wouldn't be an issue for you or I. Yeah, we would probably be able to overcome the flu without too much of a problem, but someone who's at high risk, they might not be as lucky. So I'm really glad that you decided to get the flu shot today. I just need to ask you a few questions first. How old are you? Okay, you're 23? Perfect. Yeah, we're not actually allowed to give flu shots to anyone under the age of 18 here. Yeah, you would have to go to a doctor's office if you had a small child or someone that needed to get the flu vaccine. Alright. Have you ever had a bad reaction to a vaccine? I'm talking about probably like an allergic reaction, hives, swelling, anything like that. No? Alright, great. How are you feeling today? You feel alright? Do you have a fever at all, or any kind of infection? No. Perfect. Okay. Are you allergic to eggs? Well, the reason we asked that question is because the vaccine is actually grown inside chicken eggs. Yeah, it's pretty interesting the way that they do that, but if you were allergic to eggs, then you could possibly have an allergic reaction to the vaccine, and, we don't want that to happen. No, you're not allergic. Okay, great. Are you allergic to thimerosal? Thimerosal is a preservative, and it is found in a lot of vaccines, but we do have preservative-free vaccines available today. You don't think you're allergic to thimerosal? Well, you're not sure. Well, that's fine, because we do have preservative-free available, which I can give to you. You'd rather go with that? Alright, great. And my last question is, which arm would you like to have the vaccine in? Well, people most oftentimes choose the opposite arm of their most dominant hand. So you're left-handed? Okay, well then we'll go with the right. Alright, if you just want to take a seat out there, I'll be out in a minute. Alright, so while I get everything ready, I brought a small paper for you to read. It's called the Vaccine Information Sheet. Yeah, it was recently updated. Every year, the CDC issues a new vaccination sheet for all the vaccines that are given. It is important for the flu vaccine to read over this because it is a vaccine that is updated every year to make sure that they're covering the strain that is prevalent. Okay, so there you go. And I'm gonna get everything ready here. We do have the pre-filled syringe, which is the non-thimerosal form. Does not have the thimerosal in it, which I know you requested. So we have that ready, and all I really need to do is just attach the needle to it. So I'm just going to unwrap the needle here. Alright, and it's very easy. All I have to do is just screw it on, and it'll be no problem. Alright, so I have the needle on. Yeah, if you just want to roll your sleeve up a little, that'd be great. Alright, and I have my alcohol swab. I'm just going to swab over the area where I'm going to give the vaccine, just to make sure it's clean and there's no risk for infection. Okay. Okay, that looks good to me. Yeah, now I have the bandage ready. Yeah, it's it's a Looney Tunes bandage. It's pretty funny, but yeah. Okay, so yeah, just rest your arm at your side, and 1, 2, 3. There. All right, you're all set. Yeah, that was it. You didn't even feel it, did you? Well, good. I'm glad. And now you don't have to worry about getting the flu at all for the rest of the season. There is a slight risk that you could get the flu within the next 2 weeks, which is completely unrelated to me giving you the vaccine today. It actually has to do with whether you already have the flu or not. So, yeah, you have just as much chance of getting the flu 2 weeks from now as you did when you walked in here. Yeah, I wouldn't worry about it too much. Yeah, if you have any questions, you can call us. You may see some redness or, some local irritation, and, that happens to some people, and that's fine. I would suggest probably a cold compress, or maybe some Benadryl or Tylenol, if you're really feeling like you need that. Yeah, that's no problem. Yeah, and if you have any other questions, please do call. Yeah, I always look forward to hearing from all my patients. Alright, great. Yeah, you have a nice day. Alright, bye.